Well, some jarring COVID numbers to report tonight. A new report from the World Health Organization found that roughly 6 million people died from COVID in 2020 and 2021. But you see the 15 million number. The number spikes to that when you take into account the people who died indirectly. That includes people who died from a heart attack or other health issues when hospitals were overwhelmed. COVID numbers are creeping higher in New Jersey. Nearly 3,500 new cases reported today. Numbers like this not seen since February. And the situation in our hospitals, unfortunately, getting a little bit worse. We have seen this before, the staircase of increasing numbers. We're now surpassing 600 patients in New Jersey hospitals. We're up just 100, or up 120 in all, just 5 days. Amid these growing numbers, scientists at Rutgers University have developed a test that detects different variants. News 12 New Jersey's Naomi Yane is live tonight with those details. Naomi?
Hey there, Kurt. At last check, 3,479 new COVID cases were reported today, along with 7 deaths. And here at Rutgers University, like you mentioned, scientists are they developed a test that's able to test for different strains of the virus. As we say goodbye to mask mandates, could that mean an increase in cases? Earlier this week, we saw a temporary mask mandate return at Montclair High School after an uptick in cases among staff, faculty, and students. This almost 2 months after the statewide school and daycare mask mandate was lifted. We've seen low transmission rates across the state for several months. However, 8 counties right now are at a medium transmission rate. Amid these growing numbers, scientists at Rutgers University developed a lab test that detects variants using molecular beacons, a technology created in the 90s, currently being used in PCR tests.
We used an adaptation of the molecular beacon in order to specifically look at the differences between the variants, meaning it'll only give a signal if a certain variant is there.
Ryan Dickton is one of the lead researchers, and he explains that most PCR COVID-19 tests only detect the presence of the virus without identifying a particular strain, which is useful for tracking where the variant spread.
It's also useful for determining which variant someone has, which can impact how they're treated, like certain antibody treatments only work against certain variants of the virus.
Dickton says the test is adaptable to emerging variants and can be run on millions of samples to track the movement of new variants that could be a potential public health concern.
When we noticed the variants becoming a problem, we knew that we had at least part of a solution to track it, which could help medically and epidemiologically.
Definitely an interesting development there. So, Naomi, let's talk about availability. Will you have to go to Rutgers to get one of these?
Not at all, Kurt. So scientists say the plan is to have that information readily available to testing companies and other labs. This way, that crucial information can get out there and it can be used widely.
Interesting story, Naomi Yane. Thank you tonight.